Fibromyalgia really in its classic sense, and I'll use that word classic fibromyalgia, meaning that it has all the classical characteristics of what the literature is talking about, what the research is really pointing to when they're discussing this disorder, that at its root is really a central sensitivity, or what we call a hypervigilance disorder. It really involves central pain processing, central sensory input processing that is doing some things that are not optimal or normal.
So welcome to Wellness Wednesday. And for this week's Wellness Wednesday, we have an excerpt from my interview with Dr. David Brady as part of the Fatigue Super Conference. Dr. Brady is an immensely experienced physician, but is also actively involved in research and developing some of the testing that we use here at the Optimum Health Clinic. In this excerpt, Dr. Brady is talking about the role of the nervous system in impacting fibromyalgia. Specifically, he's talking about hypervigilance disorder, our nervous system being overactivated, and how that can have an impact in terms of causing symptoms. I recognize for some people this might be a little bit controversial. I do want to qualify this by saying that obviously everyone's experience is unique and different, and these kinds of maps and ways of looking at things are really helpful, but we also have to, of course, understand that every patient is unique and different in their own manifestation and their own experience. So I should also say that this very much correlates with what we see and part of how we work in the psychology department here at the Optimum Health Clinic. So those of you watching this that have done psychology work with us, I think this will be a helpful way of understanding a bit more of the relevance of that work to impacting on fibromyalgia and specifically on the pain element of fibromyalgia. So here is Dr. David Brady. How would you define fibromyalgia? So specifically fibromyalgia, how would you classify and define that?
Well, it's interesting. Fibromyalgia really in its classic sense, and I'll use that word classic fibromyalgia, meaning that it has all the classical characteristics of what the literature is talking about, what the research is really pointing to when they're discussing this disorder, that at its root is really a central sensitivity, or what we call a hypervigilance disorder. It really involves central pain processing, central sensory input processing that is doing some things that are not optimal or normal. And so it has all the classic characteristics. And we use that terminology because in my experience as a clinician, and then talking to a lot of colleagues that also do similar things to what I do, but also in looking at actual research that's been done, the vast majority of people that come in to a provider's office and say they have fibromyalgia or have been diagnosed with fibromyalgia, and that takes many forms, right? It could be that their neighbor told them they had fibromyalgia. It could be that they consulted Dr. Google or WebMD. Or it could be that their family physician diagnosed them, or it could be that a rheumatologist at an academic center of excellence diagnosed them. But still, the vast majority of them don't have classic fibromyalgia. They have stuff wrong with them, right? They have real problems that they're not making up, but they have issues that the doctor is not getting to the bottom of. It's flying under their radar, so to speak, and they're getting an erroneous labeling of fibromyalgia. And often, unfortunately, they're being put on the medications for fibromyalgia that if you really don't have a central pain processing disorder or a central sensitivity disorder, the drugs have very little chance of helping you, but a pretty high probability of causing significant side effects. So, it's really critical that you get it right for a lot of reasons. But the classic fibromyalgia patient, they have pretty defined things, right? Their major complaint, if you will, or symptom, if you ask them, is generally this sort of unrelenting achiness or pain in their body. But it's not just anywhere in their body. It's not in specific places. It's not confined to specific reasons or regions. This is truly generalized or global pain. They have pain everywhere. They're achy most places in the body, particularly in the softer compliant tissues. And that's where the disorder gets its name, fibromyalgia. Algia, pain, myo, muscle, fibro, the fibrous compliant soft tissues. In other words, it's not bone pain, it's not joint pain, right? It's not arthritis. It's pain that's perceived in the softer compliant tissues. But when you dig deep into it, the pain isn't being generated by problems in those tissues. The problem's not in the muscles, it's not in the fascia, it's not in the tendons, it's not in the ligaments. It's in the way they're perceiving their experience in their brain, but they're feeling this pain or perceiving this pain out in these areas of the body. It's not unlike phantom limb pain in someone who's an amputee, right? Years later, they can still have pain in a leg that's no longer there. Well, I got news for you. The problem is not in the leg. The problem's in the brain and how it's being processed. So treatment directed at the leg obviously isn't going to work. And just the same in classic fibromyalgia, generally, treatments directed at the somatic tissues, the muscles, the fascia, all the body work, acupuncture, chiropractic, all of that kind of stuff, generally yields poor results unless they also have myofascial pain syndrome or some other type of muscle problem. But it's a central problem that needs to be treated centrally. And since it is a centrally mediated issue, you have other issues that are involved. So it's not only this perception of pain throughout the body, it's centrally mediated phenomena like anxiety, panic attack, common, inability to get into deep, refreshing sleep. So they don't want to get into stage 3 and 4 delta wave restorative, rejuvenating sleep. They can sleep 14 hours and they wake up feeling like they never slept. So they try to sleep their way out of it and they can't, right? So they get up feeling like they never slept. It's called unrefreshed sleep. And it has a very typical pattern in a sleep study that most sleep study centers never look for. It's called alpha wave intrusion during delta wave sleep. But the other manifestations that are centrally mediated, sort of by proxy into the enteric nervous system, is a lot of vague GI problems. Gas, bloating, postprandial distension and bloating, constipation or constipation alternating with diarrhea. Most of these patients meet the criteria for irritable bowel syndrome and often get diagnosed with irritable bowel syndrome. It's almost 100% with true classic fibromyalgia. And then the final latch is persistent, unrelenting fatigue. That is different than chronic fatigue syndrome in many ways, particularly in its origins. It's not necessarily that fatigue that tends to come on after a viral, like flu-like illness. There's not objective alterations in the patient's immune system, in the way their lymphocytes are behaving and in the relative counts of their lymphocytes and ratios and so forth. So it's not a post-immune challenge type of fatigue disorder. It's really something different. There just happens to be fatigue associated with this disorder as well. And I guess the final thing that's very common in these classic fibromyalgia patients that can help you differentiate it from those who get the label and don't have it is that it's almost always a woman. It's a female disorder. Almost 100%, not 100%, nothing's 100%, but if I have a male in my office saying they have fibromyalgia or being diagnosed with fibromyalgia, I'm very, very skeptical of that diagnosis. It's basically a female disorder, and it's often a learned experience on how that female brain deals with the world and deals with sensory input from a world that the perception of that world was altered usually early in life, usually in early childhood. There's a strong correlation with difficult childhoods, parental strife, divorces, substance abusing parents, physical abuse, verbal abuse, sexual abuse, not 100%, but it's way more common in these patients that go on to develop fibro, anxiety, panic disorder, IBS than in the general population. So the female brain, when it's young, when it's neuroplastic, when it's learning how to deal with its world, can often get locked into this aberrant stress physiology and get in a state of hypervigilance, which is oddly enough, well, I guess not oddly, makes sense, is very similar to what you see in post-traumatic stress disorder physiology, for instance. So Moll and others have researched this and talked about it as life-distressing events, if you will, but they often have difficult stories in their childhood.
Yes.
It wasn't the greatest thing.
So I hope you found that clip from the interview interesting. You can watch the full interview with Dr. David Brady as part of the Fatigue Super Conference. You can still purchase the online access to the entire conference of the recordings of all of the sessions. So tomorrow on the vlog, we're going to be talking a bit more about cultivating self-love. I wanted to build upon what I talked about with Katrina in yesterday's session. So for Thoughtful Thursday tomorrow, we'll just unpack some of that a little bit more and understand a little bit more about some of the tools that one might use to help and cultivate self-love. I look forward to talking with you then.